We are okay. Good afternoon for our beloved doctor. Thank you for joining our webinar Zoom this noon with the title Clinical Evidence of RNA DNA Complex to Reverse Skin Aging with IUMA Unlock Timeless Radiance with our beloved speaker, Dr. Fiorella D.
Hello, nice to see you. I'm very happy to be here.
Nice, thank you. And also Mr. Henry as our CEO of the Anaya di Kencana and also for all the team of Anaya. Selamat sore dokter-dokter semua. Terima kasih banyak sudah meluangkan waktunya sore hari ini untuk di sharing session kita. Sebelum kita mulai, before we begin our presentation, I would like to introduce myself first. My name is Dr. Wiwi Salviana. I'm a medical doctor and a trainer, and also as a Chief Medical Officer of FPT Anaya di Kencana. Before we begin, I will explain about our profile company and CV of our beloved speaker in Bahasa. Uh, Sebelum saya menjelaskan terlebih dahulu mengenai profil company perusahaan, alangkah baiknya saya jelaskan dulu bahwa hari ini kita akan diskusi menjelaskan mengenai salah satu produk unggulan dari PT Anaya yaitu IUMA, yaitu skin booster kita, dokter. Jadi memiliki keunggulan yaitu mengandung RNA dan DNA kompleks, di mana ini bagus banget untuk repair damage skin dan juga untuk anti-aging. Nah, untuk Anaya sendiri, Anaya itu sudah berdiri sejak tahun 2024. Mungkin beberapa dokter di sini sudah menjadi loyal customers kita ya, Dok ya. Jadi perusahaan kita ini bergerak di trading produk estetik dan ethical dengan visi yaitu menjadi salah satu perusahaan dagang yang bertujuan untuk meningkatkan kecantikan dan kesehatan melalui teknologi yang canggih dan pelayanan yang luar biasa. Kantor Anaya sendiri itu beralamat di Foresta 7 BSD Tangerang. Dan kita biasa untuk ngadain free live demo di kantor. Jadi nanti kalau dokter-dokter tertarik mengenai produk IUMA, nanti boleh daftar ke sales kita untuk free live demonya. Nah, Anaya sendiri bergerak dalam penjualan produk estetik, baik itu benang, filler, skin booster, kolagen stimulator, suplemen kesehatan, dan juga produk skincare. Nah, demikian Dok penjelasan singkat saya tentang profil perusahaan. Dan selanjutnya saya akan bacakan CV pembicara kita sore hari ini. Dr. Fiorella, please give me 5 minutes to read your curriculum vitae to our beloved doctor before you begin your presentations. I will explain in Bahasa Indonesia. Oke, Dr. Fiorella itu kelahiran tahun 1986, 23 Mei. Beliau lulusan dari Fakultas Kedokteran Universitas Degli di Sassari, Italia. Kemudian beliau juga melanjutkan master degree-nya di International College of Aesthetic Medicine, ICAM, Milano, Italia. Beliau juga mengikuti pelatihan tahun 2016 di SIAK, yaitu tentang Hair Restoration Surgery, 2019 Cadaver Course Advanced Technique in Aesthetic Medicine, dan 2021 mengikuti Self Filler dan Savvy Hair Course. Kemudian beliau juga memiliki spesialisasi ya dok ya, yaitu pengerjaan body treatment seperti subsisi, dermatologic surgery, thread lift, Brazilian buttock yaitu body filler, face treatment. Kemudian beliau juga memiliki spesialisasi di derma filler, botox, peeling, mini surgery, dan juga beliau juga aktif sebagai trainer dan KOL dari Loves Medical dan Mark Medical Italia sejak tahun 2019 sampai sekarang. Nah, kalau dokter yang tahun ini ikut IMCAS Paris 2026, dokter pasti udah nggak asing lagi sama beliau karena beliau merupakan salah satu pembicara juga di IMCAS Paris tahun ini. Kemudian beliau juga aktif sebagai penulis dok, jadi dokter bisa lihat beberapa jurnal yang udah publis hasil karya beliau. Oke. Oke, demikian mungkin CV singkat Dr. Fiorella. Here we come. Please welcome Dr. Fiorella to begin your presentation. You have time around 1 hour to present your slide, doctor. Please, doctor.
Okay, thank you so much for your nice introduction. I'm very happy to be here. Let me just share my screen and let me know if you see it properly. I think so, right? You can see it properly. Okay. So again, thank you for the introduction. I am Dr. Fiorella D. Very happy to be here, and I hope one day I will be able to come visit you in Indonesia to meet you in person. So I am a KOL for Love Cosmedical and Mark Medical since a while now. I just want to spend a few words about the company. I really believe in the company so much because they are very much focused in the scientific part. So the whole scientific background of all the products that they make has a very strong base. There is a factory based in Italy that I invite you to visit. So that's definitely something very strong as that we can trust as the product. So today's focus will be about IUMA. It is an amazing product, and I want you to guide you through the idea of new concept of biorevitalization. So it's going to be a presentation about brief introduction about how the area of biostimulation has changed through the latest years in order to understand why IUMA is such an amazing and powerful product. We will just start with the idea of the aging process. Of course, we know how the aging process can be related to intrinsic causes such as genetics, oxidative stress, and also extrinsic that are something that our patient can be exposed to through their daily life. But what we are very much aware of, as you can see from this beautiful picture of this famous Italian actress, Sofia Loren, how the face go through changing during the involution of the aging process. This shows how we have changes on the face that can be summed up by the reversal of the beauty triangle. This shows us how we can get differences, how we can get the involution of the aging through different layers of the body. This means that we actually have aging even on the bone structure. It's very well known how much we can notice, for example, the flattening of the forehead during the aging, how we can get extension of the orbit, or for example, we can get atrophic reception of the maxilla. Moving on, we know how even the soft tissues go through aging, which includes the ligament, include the fat tissue. Let's think about, for example, the malar fat pad. Malar fat pad goes through aging by reducing its volume and also it slides down. It slides towards the mid part of the face. That's where you get the nasolabial folds, and towards the lower third of the face. That's where you get more heaviness on the lower third. And we go back to the reverse of the beauty triangle. And also we can notice how even the aging is different between every patient. Because, for example, you can see from those pictures of the periorbital area, some patients you will see they have more of a sunken pattern. So they lose volume. They lose the volume of the fat of the periorbital area, and also the orbital retaining ligament go also through the aging process and loses its strength. So it will not contain the fat pad. Or as another example, we can get patients who have the typical eye bags, so their periorbital area becomes actually more puffy because there is the herniation of the fat of the periorbital area. And of course, last but not least, we have the aging of the skin, which is what we mostly deal with in our clinical practice. Because, for example, we can get thinning of the dermis. We definitely can notice loss of elasticity. We can get stains, whether it's hyperchromic or hypochromic, and of course, vascular blemishes like Cooperose, like spider nevi, and so on. And of course, the wrinkles. Regarding the wrinkles, we have a lot of different types of wrinkles. So, for example, we are very familiar with the mimic expression lines that are mostly targeted by toxin. So most of the time you find them in the upper third of the face. We can get elastosis line. So this mostly happens for some genetic patterns, so the patient doesn't build up the collagen in the right way anymore, or from extrinsic causes, for example, extreme sun exposure. We can get ripples, or what are so-called the pillow creases. Pillow creases are due to repetitive position. For example, any experienced doctor can tell on which side your patient usually sleeps. For example, because you can get obliquous line on their forehead because they sleep, for example, on their left side, or they have more deep, for example, nasolabial fold on one side rather than the other because they sleep into that. So we can get different kind of patterns. But what goes on biologically? So we have the clinical aspect of the aging, what's happening biologically. So what we can notice is for sure there is mitochondrial dysfunction. That all of our cells go through aging. So our body goes through aging, and every cell, of course, is aging. There is chronic inflammation. This is very important. The communication between every cells in our body, it's not as performative as it was before. We don't produce the proteins as we used to, so the loss of the production of proteins, and of course there are some alteration of the DNA. So this can be summed up with the concept of inflammaging. Inflammaging is a very powerful concept that explains how our body, so not only our skin, but obviously our whole body goes through chronic inflammation, because through the senescence, so through the aging process, we start produce more inflammative interleukins, especially interleukin 6, and also the production of metalloproteinases gets much, much higher. So let's say we try to fight the oxidative stress as much as we can, but of course the aging plays a key role in that. So with all that said, this means that basically we were doing something wrong in the past, considering the biorevitalization concept. What I mean by that is that before we were focusing only on the fibroblasts. We were just thinking that in order to fight the aging process, we just needed to produce more collagen, which is okay, but it cannot be only that. So we need to make a bigger target, because there are different stages, different layers that go through aging. So we definitely need to make a bigger picture. That's why we realized that we needed to shift from focusing on just fibroblasts and on just collagen to have a bigger target in order to have a global effect of anti-aging and to target different cell types, different structures of our face, for example, and different layers. Let's think about, for example, of course, we can target melanocytes, we can target preadipocytes, keratinocytes. So we have much more target than just the fibroblasts, and that way we can have a better outcome. Also, the idea of just stimulating, increasing, and overstimulated, we switched from just the idea of stimulation to modulation. I always give the example of the keratinocytes. If you think about the keratinocytes through the aging, they actually, we need to slow down their action because most of the time over the years, we get hyperpigmentation. So for sure, we don't want to stimulate the keratinocytes, but actually we want to make modulation, so to regulate their action in order not to be extremely powerful and extremely performative in the specific case of pigmentation. So this introduces us to a new concept of balance the environment where our cells are living. So we need to switch and to create a perfect balance between stimulation and downregulation in order to create a balance of the environment to keep all of our cell types in a healthy environment. So again, for example, let's think about the extracellular matrix synthesis. We need to balance from growth factor to the elements that actually make degradation of extracellular matrix. And again, we go back to the idea of balancing. So going back to, let's say, our clinical aspect of our daily practice. So we get patients who, we make assessment of our patient. Of course, I'm not going to tell you that biostimulation is going to fix and reposition your volumes, the volumes of your patient. You need to make proper assessment and make sure you do the right diagnosis. Of course, if I need big volumes, if I need replacement of the structures, I'm going to go for fillers, but that's another kind of issue. Today, we are focusing on the idea of curative kind of treatment, which is a perfect target for IUMA and biostimulation. Give me 1 second. Okay. So that's why this is the introduction of the new concept of biostimulation, because I want to really stress the fact that we are focusing on a bigger target in order to get the best outcome for our patient. So with IUMA, for sure, you're going to target different cell lines, different structures to get aesthetic outcome, of course, positive biological effect, because you're not going to increase the inflammation of the tissue. We have anti-aging, antioxidant properties, and we are shifting our focus not only on the fibroblasts. So obviously the areas that we can target with IUMA are a lot. We will see throughout our presentation that we're going to target not only the face, but also, for example, neck, décolleté, and hands. What is the composition of IUMA? I try to give you just small infos about every ingredient, but you can see how complete the formula is. We have HA, niacinamide, N-acetylcysteine, tripeptide 29, glycine, proline, arginine, argyreline, and RNA DNA complex, so the polynucleotides. Niacinamide is actually my favorite ingredient. It's such a powerful ingredient because its properties are literally amazing, because it has antioxidant properties. So we can fight against the oxidative stress, which goes back to the inflammation that we were talking about. We are able to increase the collagen production with niacinamide. So clinically, we will get reduce of fine lines and wrinkles. And it's a key ingredient to keep the skin barrier very performing. So what niacinamide do is reduce the transepithelial water loss. So it keeps the skin very hydrated. And one of the, I think, most interesting function of niacinamide is the fact that we can use it for improving the glowing, reducing the hyperpigmentation, and again, to improve the skin yellowing of our patient. That's why they're going to be very happy with IUMA, because they will notice a very nice signature glowing effect after the injections. Why? Because niacinamide it actually interferes in one of the stages of the production of melanin, of the pigmentation, because it blocks the transfer of the melanosome from the melanocytes to the keratinocytes. So it blocks that stage, so it will improve a lot the pigmentation. Even on some patients, we have nice before and after, even on patients who have melasma. Acetylcysteine is also a very powerful antioxidant. It also helps to regenerate the glutathione, which is absolutely the most powerful antioxidant agent, but also prevents the action of the metalloproteinases. So it will reduce the degradation of the extracellular matrix. So it will reduce the degradation of collagen. Hyaluronic acid, we have in the formula 2 molecular weight of hyaluronic acid. We have low and high molecular weight, 1% of hyaluronic acid. With low molecular weight, we're going to be able to stimulate fibroblasts and keratinocytes. So we can get improve the volume and the skin tone of our patient. High molecular weight, also 1%, that will help us keep our patient's skin very much hydrated, and also works as a dermal scaffold. Then we have tripeptide 29. Tripeptide 29, it's formed by 3 small peptides: glycine, proline, and arginine. How does tripeptide 29 work? Basically, it works as a signal peptide. So we introduce very small dimension peptides that will work as a signal for our skin. To make it very simple to understand, basically, the feedback that our skin gets is that we are lacking of collagen, because it is all fragmented, because we have very small peptides. So the answer is going to be we need to produce more. So the answer to the injection of tripeptide 29, it's actually to stimulate type 3 collagen. This is going to end up improving, of course, the skin texture and decrease the fine line, fine wrinkles appearance of our patient. Acetal hexapeptide. It is the ingredient that we call Botox-like effect. Of course, the target, it is more related to the upper third, or in general to the mimic lines, as much as it is for toxin itself. It is called Botox-like because it works by breaking down the SNAP25, which is the protein that would help us create the snare complex. Snare complex, if you remember, is the one that will result in actually making the muscle contraction, because it will, once the snare complex is formed, we can get the release of the catecholamine. With the acetyl-hexapeptide, we're going to break down the SNAP25, so the snare complex, it's not longer able to be formed, so the release of catecholamine will not be happening, so that will release the contraction, smooth down the contraction of the mimic lines. Last but not least, the polynucleotides. So polynucleotides are a small fragment of DNA and RNA. They are highly purified fragments that are extracted from the salmon seminal germs cells, because they are mostly similar to the humans. But of course, in that case, you will have much less risk of immunological interaction. Polynucleotides have been on the market since, I think, almost 30 years now. So the literature is full of papers, scientific papers related to the polynucleotides. I try to include in the presentation just a couple that I found that are the latest. One is very interesting because it was published from some Italian doctors, and it is related to the consensus. So it's basically a review of the polynucleotides, and it shows, it gives you a bit of a guidance on how to, best way to inject, safest way to inject, and also how you can combine. It proves the priming effect of the polynucleotides that I will mention later on in the next slides. I found also this paper. This is very, very, very recent. It's from 2024 from some colleagues from Hong Kong and Korea. It basically proves the way the polynucleotides work. So the mechanism of action of the polynucleotides. Just to break it down for you, polynucleotides work with three different mechanisms of action. We have adenosine receptor stimulation, salvage pathway, and isoosmotic pathway. So with adenosine receptor stimulation, so basically what we get is we create a sort of events one after the other by the activation of the GS protein. Stimulating adenylate cyclase is going to produce a lot of IMP cyclic. IMP cyclic is going to boost the energy of our cells, and that's going to improve all the patterns and all the action of our cells. So it's going to increase the synthesis of extracellular matrix. It's going to downregulate the inflammation because, as we said, through the aging, we have extra production of inflammatory interleukins, such as interleukin-6. By this pattern, it's going to reduce and inhibit the inflammation itself, so reducing the production of interleukin-6. and increase the vascular endothelial growth factor and angiogenesis. That's why, for example, the polynucleotides are extremely powerful and extremely useful to treat, for example, scars, even recent scars. I have actually some nice before and after regarding that. Another mechanism of action of polynucleotides is the salvage pathway. Salvage pathway works basically as a recycle, which means that the polynucleotides are going to be used as the cells, instead of producing ex novo nucleotides, is going to use the ones that we inject. That's going to be an amazing optimization of the cellular balance and the cellular energy, because if we don't have to produce nucleotides, we have them already ready to be used. Of course, the cells are going to be using much less energy, and to actually use the energy to make proliferation. And that's what happens with polynucleotides. We give basically the fuel and the background to produce and to accelerate the DNA replication and the RNA synthesis. Last but not least, we have isosmotic hydration. The polynucleotides can strongly attract and bind the water, so the hydration is going to be extremely powerful. And we have an amazing capability of scavenging. As we said, we can fight the reactive oxygen species, so we can fight productively the inflammation. So this is just to sum up what we can actually do with polynucleotides. We definitely have a multi-level biorevitalization. We have a bigger target rather than just the fibroblasts. Yes, we have collagen synthesis, but we also have promotion of hydration. We have scavenging, and of course, we can increase the number and the viability of the fibroblasts. So we definitely made the bigger picture and the bigger target. How can we place our polynucleotides clinically? What we can use them for is, for sure, as pure dermal reactivating properties. So for sure, they're going to be amazing as biorevitalizing agents itself, just by using them for that reason. But also they are great for priming. This is a very good key point, because it's like we are preparing the background, the ground for our patient, and whatever treatment we're going to do next, or in combination with the polynucleotides, it's going to be even better. So they work as background preparation for the tissue before or in combination to other treatments. So obviously our outcome is going to be better, faster, and more performative. So IUMA is going to help us with all that, because again, we don't only have polynucleotides, but we have, as I mentioned before, a lot of other ingredients. Each one has a key role to the best outcome of our patients. So we can get improvement of the skin texture. We can get reduce of the imperfection, whether it's the stains or the fine lines, and of course, improvement of skin tone, elasticity, and radiance. What is the protocol for IUMA? Of course, our job is to make the proper assessment. So once we get our patient, we can evaluate if it has glucose of 1 and 2 or glucose higher, more aging process like glucose 3 or 4. In that case, we can decide whether we want to do 2 or 4 sessions. It is important that every session is performed every 2 weeks. So we need 2 weeks distance between one another. And then the protocol is going to be either to repeat the cycle after 6 months, or we can do a single dose monthly after a couple of months that we do the cycle. It's up to you, but most of the time usually happens that your patient is going to ask for another session in order to get the maintenance of the results of IUMA. Regarding the amount of product that we need, again, it can change a little bit based on the aging scale of our patient, but I would say that 1 ml, 1.5 is for each area. So face, neck, décolleté, or hands is definitely more than enough. Where is the target of our injection? So we're going to be quite superficial. We are targeting the epidermis, the dermis, and superficial subcutaneous soft tissue. This is important because it's going to be up to us to choose how we're going to inject our product, because that's going to change a little bit the outcome of and the results. And we cannot use the same pattern for every patient, because every patient is going to have different kind of skin issues. So we have 3 different options of injection. We have dermoepidermal biostimulation, dermal biostimulation, and subdermal. We're going to see all 3 and when we should perform each one. So for dermoepidermal biostimulation, you can use, of course, microneedling. In that case, when should we use and choose microneedling rather than injection? When you want to target more superficial skin issues. For example, your patient has elastosis. You want to improve skin texture and improve also, for example, the enlarged pores. In that case, we can be more superficial and target by simply microneedling. Other clinical situation is when you want to perform a dermal biostimulation. As you can see from the video, we are performing the papules. The papules are done with your needle placed almost parallel to the skin. It's actually an inclination of 30 degrees to the skin. You need to just use the tip of your needle. That could be a 30 gauge or even 33G needle, so a very, very fine needle, creating what we call the papule. So you can see the whitening, the transient ischemic whitening, because the dermis, it's not extensible, it cannot extend. That's why it shows the papule. But that actually means that you are in the right layer. So when should we use this pattern of injection? When you want to target fine lines, when you want to target, for example, elastosis, you want to target stains, so pigmentation, or for example, melasma. Also, considering the face, this is the best way of injection for the periorbital area and for the forehead, for example. How long are those papules going to last for? Because, of course, either your patient is going to ask you about that, or you need to tell them before. They're going to last maximum a couple of hours. So of course, if your patient is going to apply some ice, they're going to last even less, but she will not have anything over 2 hours maximum. Then we have subdermal biostimulation. Subdermal biostimulation requires a deeper injection. So you need to be a little deeper. So even the inclination of your needle needs to be higher. So we are talking about 45 degrees of inclination. In this case, as you can see, there is no papule because you are deeper, and no ischemic, transient ischemic whitening because we are definitely on a deeper level. The target of this type of injection is dehydration, loss of skin tone, so the laxity and the shadowing. You can use it especially in mid-third of the face and lower third. I think is the best option in terms of injection. In this case, even the downtime after treatment is going to be a little less because the papules will last longer than the subdermal biostimulation. There are also other areas that we can treat with IUMA. Of course, we can definitely target décolleté. For the décolleté, I would also suggest to perform the papula pattern of injection because we need to be more superficial. But if your patient has a very thick dermis and a lot of skin laxity, even on this area of the body, you can perform also deeper injection. The neck is also a target for IUMA. Actually, the neck, we need to distinguish between two different kind of skin issues. We can have the neck lines or tech lines, sorry, venous, we call it venous lines or tech lines. In that case, I think best way is also to perform papula, so small injections along all the lines. But most cases we have, let's say, a double pattern, which means we have the tech lines, the fine lines, but also skin laxity. So what I do the most is do the two different kind of injection, epidermal and so dermal and subdermal injection, so that I can target both the skin laxity, but also the fine lines. The hands are obviously another target. In that case, we can simply perform a very superficial kind of injection. Again, the 33 gauge needle, it's absolutely okay. Just what my tip is just to make sure you have a Luer lock syringe because IUMA, it's quite thick product. So if you don't have a Luer lock syringe and you have such a small needle, you might end up making basically your syringe explode from the pressure if you want to use such fine needle. Other option, as we were saying before, is related to the fact that polynucleotides are such a good product for priming. So we discussed that before. We're going to create the perfect background with IUMA to any treatment we're going to use next. So for example, this is one of the combined treatment that I use, which is injections of IUMA plus peeling, which is also from Mark Medical, so from the same company. It is a soft peeling that contains 3 families of active we have acids such as with glycolic, malic, lactic, salicylic, and TCA. We have moisturizer and peptides. What I do is on the same session, because you can see this patient has a lot of papules. She suffered from acne scars in the past, but her skin improved so much thanks to IUMA. But on the same session, so first I perform the injection, and then I place my product of the soft peeling on top of it. So of course, the power of the acids are going to be even more because I damage the skin with the small injections performed previously. So obviously the outcome is going to be even better. So again, why the idea of combined protocols? To give even more of a wow effect, so to improve the compliance of our patient and to get even better outcome. Another treatment that I do in combination with IUMA is fractional laser. I have a non-ablative fractional laser, and most of the time I perform 3 sessions. On the first session, I combine the injection with the laser to improve the skin quality, to even to reduce the fine lines even more. Second session, I only do injection, and third session, I do the combined treatment as well. This is just an example on how you can, let's say, play with IUMA. It's going to be a solid background, so a solid starting point for if you want any other treatment that you're going to use next. Now I will share with you, just to go back to the clinical part, a couple of before and after. Just to show you how what kind of results you can reach to. This is done by a doctor in South Africa. He used very deep microneedling with IUMA in order to create such much more like basically a total resurfacing of the skin, all placed by IUMA, which is very important because thanks to the polynucleotides and all the antioxidant ingredients, he was able to reduce all the inflammation related both to the procedure and, of course, to the aging. This is a nice case of melasma. I think the key role was from the niacinamide. Niacinamide, again, as I said before, it's a very powerful ingredient that has a strong role in the pigmentation. So it's going to be, you're going to get very nice results even on pigmentations with that. Same as with this patient with melasma on her forehead. Periorbital area. As we know, periorbital area is a very tricky area. We cannot treat all patients. For example, we are very much aware that sometimes your patient come in asking for filler. But we are much aware that fillers are not on the periorbital area are not suitable for every patient because they might cause over time water retention. So they're going to end up having puffy eyes from the filler that they wouldn't have if you didn't treatment. So it's a tricky area. Most of the time they do have a loss of volume, but most of the time also pigmentation. So IUMA is going to be an amazing tool for that. Also, thanks to the action of the polynucleotides, because as we mentioned, they have also a powerful capability to attract water, to bind water, as well as obviously the hyaluronic acid, but also again the niacinamide plays a very important key role in reducing the pigmentation of the periorbital area. Then I think there are some interesting cases related to the scars. Those before and afters are kindly we received them from some doctors from Ukraine, where there is currently a war. So unfortunately, they deal with a lot of patients who have been injured from the war, from all ages. And I met them in a recent cadaver lab in Verona, and we were sharing some experiences with IUMA. And they told me we have amazing before and after. We are getting a lot of very nice results on patients that have issues and have injuries from the war. This is again because we are able to improve through one of the mechanism of action of the polynucleotides. We are able to improve the vascular endothelial growth factor to improve the angiogenesis. So the regenerative potential of IUMA is really outstanding. Also an amazing case from a scar from an injury. I think it was just 2 sessions, also from Ukraine. So I think there is definitely another indication that we can use IUMA for. Also some scars. This was from other kind of injuries, but this guy really responded so well from the sessions. And of course, the wrinkles itself. Speaking of contraindication, there is no difference between any other treatment. Of course, obviously, pregnancy and breastfeeding as usual, severe autoimmune disease, but we don't have any kind of complication that has been reported since I think 8 years that the product has been on the market. So for sure, IUMA is going to be an amazing tool in your hands, in your clinic. It's very versatile. You can use it for a lot of different clinical cases, from the very young patient who wants to improve skin quality or do a prejuvenation kind of treatment. So start fighting the aging process in a preventive way, or for more âgé patients who have already some clinical evidence of the aging, and it can definitely show you a lot of good results in terms of skin quality, hydration, and reducing the wrinkles itself. I just want to wrap it up with the message that that the aging, of course, is such a blessing. So I don't like the fact that we fight the aging process. We just need to embrace the aging and guide our patient on every stage of their life, whether they're young to up to 90 or even more, 90 years old, in order to age gracefully and in the healthiest way possible. Thank you so much for your attention. And I think we will have some time for questions if you have any.
Okay, thank you very much for your presentation, Stephen and Flux.
Thank you.
Um, Thank you, Doctor, for the highly insightful presentation. It was really clear and detailed. I'm so really happy because a lot of knowledge today that I have from you. And I feel like I'm in classmates, like I got some uh, knowledge from you. And
Thank
maybe before we're going to Q&A session, I would
you.
like to recap your presentation first in Bahasa Indonesia, maybe in 10 minutes, Doctor.
Oke, oke.
Oke, baiklah. Terima kasih banyak nih dokter-dokter. Tadi presentasinya Dokter Fiorella menurut saya detail banget dan bagus banget. Jadi berasa kita kayak lagi kuliah nih, lagi kuliah biomed ya dok ya. Jadi beliau jelasinnya bagus banget. Jadi saya mungkin akan menjelaskan poin-poin pentingnya aja dari presentasinya beliau tentang apa sih keunggulan dari produk IUMA, faktor-faktor yang menyebabkan kenapa aging proses itu terjadi, kemudian tata laksananya seperti apa, protokolnya seperti apa, dan kontraindikasinya seperti apa. Oke, yang pertama saya jelaskan mungkin dari faktor aging dulu, bahwa tadi dokter juga menjelaskan untuk aging sendiri itu dipengaruhi oleh faktor intrinsik dan ekstrinsik. Nah, kalau untuk faktor instruksi sendiri itu dipengaruhi oleh genetik ya. Jadi gender juga pengaruh. Kemudian kerusakan dari mitokondria juga pengaruh. Kemudian faktor stres oksidatif juga berpengaruh. Kemudian hormonal dan biochemical juga berpengaruh. Nah, kalau untuk faktor extraction sendiri yaitu dari faktor merokok, kemudian sun exposure yang terus-terusan itu juga bisa menyebabkan status wrinkle pada seseorang. Kemudian repetitive facial expression, jadi orang-orang yang ekspresifnya terlalu berlebihan, ya itu biasanya resiko untuk terbentuknya fine wrinkles itu lebih lebih cepat dibandingkan orang-orang yang lebih ekspresinya datar seperti itu, ya. Kemudian selain itu juga ada faktor yaitu perubahan dari bentuk struktur tulang seseorang, baik itu di tulang zigomatikus, os maksilanya, tulang maksilanya. Jadi seiring bertambahnya usia, ada pengikisan pada tulang-tulang baik itu di frontalis, temporal, periorbital, zigoma, kemudian di tulang maksila, sehingga itu menyebabkan degradasi penurunan. Itu yang menimbulkan adanya ptosis, kemudian terbentuknya uh, cekungan pada area smiline, marionette line, ataupun area labelarnya. Nah, selain itu, atrofi otot juga berpengaruh dok, ternyata dari penjelasannya dokter Fiorella, yaitu atrofi otot zigomatikus dan otot maksila seseorang itu juga membuat struktur wajahnya menjadi turun. Nah, selain itu, em, ingredients apa aja sih yang ada di IUMA sehingga membuat IUMA ini menjadi sesuatu skin booster yang dokter udah mulai bisa pertimbangkan untuk dokter pakai nih sehari-hari. Yaitu pertama, IUMA itu mengandung asetilsistein, yaitu salah satu antioksidan tinggi yang berfungsi untuk menginduksi pembentukan kolagen dan juga sebagai apoptosis untuk sel-sel yang jelek itu diapoptosis sama asetilsistein gitu. Kemudian niacinamide, tadi juga Dokter Fiorella udah berapa kali menyebutkan niacinamide, dia suka banget pada produk ini. Kenapa? Karena kandungan niacinamide-nya yaitu bagus banget dalam mengurangi kerutan dan garis halus. Cara kerjanya yaitu dengan meningkatkan produksi kolagen, kemudian menurunkan aktivasi dari glicosamino acid yang menyebabkan elastosis kulit itu berkurang, sehingga juga dapat membantu untuk menghambat pembentukan pigmentasi. Gimana cara kerjanya? Kok bisa sih niacinamide itu menghambat hiperpigmentasi? Yaitu dia memblok atau menginhibisi melanosom untuk menjadi sel melanosit berubah ke keratinosit. Jadi diblok di situ, yaitu di lapisan epidermal layer, sehingga hiperpigmentasi itu tidak terbentuk. Ya. Nah, yang ketiga yaitu ingredients yang bagus lagi yaitu hyaluronic acid, di mana tidak semua produk skin booster itu ada kandungan HA-nya. Jadi di IUMA ini kenapa spesial? Dia HA-nya enggak. Jadi dia ada double HA, yaitu yang low wake HA dan high wake HA dengan ukuran kilodaltonnya. Kalau yang low 155 sampai 230 kilodalton, sedangkan yang high yaitu 850 dan 1000 kilodalton. Nah, keunggulannya apa nih dengan dua ingredients produk ini? Kalau misalnya yang high HA, dia akan mengikat molekul air itu lebih lebih kuat sehingga dia nggak gampang untuk menyebar ke area yang lain. Yang tadi apabila diinjeksikan di area periorbital, pada beberapa kasus itu meningkatkan risiko saggy skin atau puppy eyes pada pasien. Nah, untuk IUMA sendiri itu cenderung lebih. Nah, kalau untuk yang low, dia tujuannya untuk mengikat reseptor dan menstimulasi fibroblast dan proliferasi dari keratinosit itu sendiri. Sehingga nanti dia ada double hydration, baik itu di epidermal layers ataupun di dermal layers-nya. Sehingga jadi lebih lama tuh efek hidrasinya. Nah, selanjutnya yang keempat adalah tripeptide. Di mana tripeptide ini ada yang tripeptide 29, yaitu glisin, proline, dan arginin. Jadi tujuannya adalah sebagai signal antar sel. Dia tujuannya untuk meningkatkan fibroblast, produksi elastin, dan juga untuk menstimulasi pembentukan kolagen tipe 3. Ya. Selain itu juga untuk memperbaiki skin texture, improvement hydration-nya juga, kemudian juga untuk mengurangi kerutan halus pada kulit wajah pasien. Kemudian juga ada acetyl-hexapeptide. Nah, tadi acetyl-hexapeptide ini apa bedanya? Jadi dia tuh mirip cara kerjanya kayak botox-like gitu. Jadi dia bukan botox, tapi cara kerjanya mirip botox, yaitu dengan menghambat pelepasan katekolamin sehingga tonik muscle kontraksi dari tonik muscle-nya berkurang, sehingga itu akan mengurangi kerutan. Kemudian yang selanjutnya yaitu ada PN, polynucleotide, di mana PN ini yaitu fragmen DNA dan DNA-nya, RNA dan DNA, dia untuk memproduksi kolagen, kemudian untuk promote hidrasi, kolagen, dan fibroblast. Nah, ada pun beberapa kontraindikasi nih dok, untuk pasien-pasien tidak boleh diinjeksikan IUMA. Yang pertama, ibu hamil dan menyusui, kemudian pasien-pasien dengan plateletisis, gangguan pembuluh darah, kemudian pasien dengan autoimun, kemudian pasien dengan cancer dan penyakit herpes itu nggak boleh diinjeksikan IUMA. Oke, kemudian key point selanjutnya bahwa IUMA ini untuk apa sih dengan sebanyak itu ingredients-nya? Yaitu kuncinya ada tiga, yaitu pertama stimulasi kolagen, kemudian untuk repair sel tissue, kemudian untuk fine wrinkles atau aging. Jadi dia bagus banget untuk kasus seperti itu. Nah, untuk protokolnya sendiri, tadi juga dijelaskan bahwa penyuntikan IUMA itu tergantung pasiennya, dia diego eh, glogau 1 atau 2 atau glogau 3 atau 4. Jadi kalau dia 1 dan 2 itu tipikal yang masih muda, yang nggak terlalu banyak wrinkle, masalahannya itu cukup 2 kali aja per 2 minggu. Tapi kalau dia glego 3 dan 4, dokter boleh injeksikan 3 sampai 4 kali sesi dengan jarak 2 minggu sekali. Itu untuk yang udah ada fine wrinkle, baik itu di area dahi, sudut mata, atau area wajah tadi yang seperti di slide-nya dokter Fiorella. Jadi kalau udah tua seperti itu biasanya kita butuh 3-4 kali. Tapi kalau masih muda 2 kali aja cukup dengan jarak 2 minggu. Terus dosisnya cukup 1 mili atau 1,5 mili untuk per area, baik itu di wajah, leher, tangan, atau dekolet, itu masing-masing 1 sampai 1,5 mili aja. Nah, untuk target injeksinya, jadi tadi di-mention juga bahwa beda layers, beda tujuannya, beda protokolnya. Kalau untuk epidermal layers, kita cukup dengan microneedling aja. Tujuannya untuk pori-pori besar, gangguan pada skin teksturnya, scars, ya, kulit kering, atau kasus elastosis, itu dokter cukup epidermal layers saja. Tapi kalau misalnya dokter tujuannya untuk kurangin kerutan tadi, wrinkle, atau untuk bekas jerawat, atau untuk scars tapi yang tipe ice pick atau yang lebih dalam, itu dokter target injeksinya di dermal layers. Terus kalau dokter lebih ke untuk volumizing atau lifting, tadi di video juga sudah dikasih lihat, injeksinya nodul, yaitu di sepanjang ligamennya. Ya, jadi dokter boleh injeksi sepanjang ligamen, baik itu di 5 titik, 7 titik, atau 8 titik ya. Itu tujuannya untuk mengurangi laxity. Laxity itu tuh kendur-kendur ya. Kemudian volumizing juga bisa. Untuk area-area nasolabial fold, marionette line itu kita bisa injeksikan dengan target subdermal. eh Oke, saya rasa itu ya poin-poin pentingnya untuk Yuma sendiri. Eh, I think it's enough for me to explain about key point of your presentation in Bahasa. Thank you very much for your waiting and attention. And we going to Q&A session. Jadi, so we start to read the question, ya, Doctor. Are you ready?
Yes, I think yes, you need to translate them for me.
Okay, okay, sure, sure. I'll help you to translate. Okay. The first question is okay. Okay, the first question from Dr. Mutiara. So what the ingredients and what the main ingredients of the IUMA and how to the application IUMA, and then several interval between treatment, first treatment and second treatment, several days.
Okay, so the main ingredients are as following. So there is hyaluronic acid, 1%, high low molecular weight. There is niacinamide, acetylazapeptide, tripeptide 29. There is polynucleotides, so fragments of DNA and RNA. I'm not sure if there is the tripeptide 29 I mentioned. I think that's it. The distance between one session to the other should be 2 weeks. So session, 2 weeks wait, and then second session. Either you can do 2 sessions or 4 sessions, but the distance between one and the other should always be 2 weeks.
Okay, thank you very much for your answer. Dokter Mutiara, jadi jawabannya dari Dokter Fiorella untuk ingredients-nya itu ada HA 1%, kemudian ada RNA DNA, kemudian ada PN-nya juga, kemudian ada tripeptide dan hexapeptide, itu yang tadi cara kerjanya mirip botox. Jadi dokter-dokter kalau masih strict nggak mau pakai botox nih, masih ragu halal apa enggak, nah dokter boleh coba pakai IUMA. Nah, untuk aplikasinya sendiri tadi Dokter Fiorella bilang itu untuk sesi 1 ke sesi 2 itu jaraknya 2 minggu. Dokter mau 2 kali atau 4 kali treatment ke pasien itu boleh karena depends of the case. Jadi tergantung kasusnya pasiennya dokter seperti apa. Dan memang dia lebih ke untuk aging. Okay, for the next question, Doctor. For the periorbital, for puppy eyes, eye bag, and also dark circle, it's a prefer injection with the pupil technique or microneedling.
Okay, this is a very good question, but I would still go for injections. Sometimes I would mostly prefer the papules injections all over the periorbital area, even on the upper eyelid. You can just put some numbing cream in the area so your patient will be very comfortable with the procedure. But I think you get the best results by injections. Microneedling here, it's okay, but you will get better outcome by papules injection, especially for the dark circles.
Yeah, thank you very much. Untuk Dokter Meta, jadi jawabannya Dokter Fiorella adalah kalau untuk periorbital, dua-duanya boleh, tapi untuk hasil yang lebih baik, untuk terutama untuk dark circle, area kantung mata, beliau menyarankan injeksi papul itu di subdermal atau intrakutan boleh. Thank you. Uh, for next question. For the scars, how to injection? Papul or uh, best device? Thank you.
Mhm. Um, okay, I think for the scars, a good option could be in microneedling because you can get better outcome in terms of actually perform a little strong microneedling. So by even making your patient bleed a little bit. So in that case, I would go for microneedling.
Ya, thank you very much, Dokter. The question for Dokter Margaret, jadi jawabannya adalah dengan microneedling ya, Dokter, kalau untuk scars. Okay, and next question. It's okay, Doctor, if there is a lot of question for you. I think the participant is really enthusiastic with your presentation.
I'm very happy. Thank you so much. I'm happy to answer.
Okay. This is a question from Dr. Friska. So it's based on my experience also. I think I ever using IUMA for the acne patient, and the result and the outcome is really good for the acne inflammations. So for the acne type, scale 1 to 5, please Patrick. Uh, there is we can use IUMA for treatment that patient with acne scale 1 to 5.
Yes, I think it's absolutely safe. Again, the um, i- it's a very good tool both for when you get acne scars, but also active acne because of the powerful potential with the fight against inflammation. As we were saying, by reducing the interleukin, especially interleukin 6, we're going to get amazing anti-inflammatory results. And also by increasing the vascular endothelial growth factor and the angiogenesis, the outcome is going to be very impressive.
So, in your opinion, that what the main factor why IUMA is really good for the acne is because of the interleukin 6 and extracellular matrix because the reduce of the inflammation, right?
Yes, yes.
Oke. Dokter Rizka, jadi jawabannya begini dok. Jadi hubungannya kenapa pada kasus pasien-pasien yang ada akne aktif ataupun scars, kenapa disuntikin IUMA itu hasilnya bagus? Jadi jawabannya adalah karena IUMA tadi cara kerjanya salah satunya adalah mengaktifasi dari interleukin 6. Interleukin 6 dan extracellular matrix di mana cara kerjanya untuk menurunkan inflamasi dan meningkatkan angiogenesis, pembentukan sel pembuluh darah baru, sehingga hal itu yang menyebabkan inflamasinya berkurang pada pasien-pasien yang ada akne aktif. Semoga menjawab ya dok, jawabannya ya. Oke. Kira-kira dok kalau mau bertanya ya pakai mic, open mic boleh ya dok ya? Nanti raise hand aja. Oke, there is another questions. How milligram? This is a question from Dr. Josephine. How many milligrams low weight HA and how many milligrams high weight HA? It's 1% or
1%, which means that out of a 5 ml vial, we have 50 milligrams of HA.
okay, 15 milligrams.
Yes.
Dokter jawabannya untuk low weight dan high weight itu masing-masing dosis HA-nya adalah 14 miligram per satu vialnya. Semoga menjawab ya, Dokter Yosepin. Okay, Doctor, maybe because IUMA is really thick, right? It's a bit painful when you injectable on the dermal layers. So it's probability if we want to combine IUMA and lidocaine. we cocktails.
Mm-hmm. Okay. To be honest with you, I never mix it with lidocaine. I know that the fact that it's a little thick when you do papules, it could be a little discomforting. But in my personal practice, I never add lido. Uh, it will not change the formula. So if you feel like it's your patients are complaining too much, you can do it. I normally I don't, but I cannot say that you cannot do it. So if you need to, you are welcome to add some lido.
Oke, thank you very much. Untuk Dokter Andini, jadi jawabannya dari Dokter Fiorella, sebenarnya kalau untuk praktek sehari-hari dia nggak pernah sih mengcombine lido sama IUMA. Karena memang ambang nyeri pasien Eropa dengan orang Indonesia itu cukup beda dok, jauh. Jadi orang Eropa itu tanpa topikal aja mereka langsung injectable, mereka kuat gitu. Tapi kalau orang kita kan rada-rada nggak kuat ya. Nah itu dokter kalau mau suntikin di koktail sama lido, kata beliau sih nggak masalah. Tapi dia nggak pernah coba. Cuman kalau boleh saya kasih saran, kalau memang pasien skala pain-nya rendah banget, dokter mungkin boleh blok anestesi dulu, entah itu di facialis nervous atau dokter topikal anestesinya agak lebih ditebelin dan agak dilamain. Biasanya sih menurut saya sih cukup nyaman ya IUMA enggak yang bikin trauma pasien gitu ya dok ya. Oke, oke. Oh, I think enough for the question. But I have my personal question for you, several personal question for you. Is that
Okay.
okay, doctor?
Yes, of course.
Um, okay, doctor, you previously explained that IUMA can be combined with acid pills. Is it sufficient to apply IUMA topical after the procedure? I mean, I look you injectable first, and after that you peel
Mhm.
the peeling. Is that make more painful for patient, or that's still normal?
Of course, the burning sensation once you apply, even if it is a soft peeling, still the acids can be perceived. So the discomfort it's a little higher because, of course, before you perform the injections. But I even tried on myself, and it's not painful. It is, I would call it discomforting, but you just leave it for 5 minutes and then rinse it off with the water. It's absolutely manageable. It's not too bad. Even in a first-hand experience on my face.
How long time you keep the peel before you
Rinse it off.
yeah cleanse
It's
off?
either 5 to 10 minutes. It
Mm.
depends on the patient. If it's burning too much, I only leave it 5 minutes. If the patient is handling well and I don't see any signs of any signs that warn me, I just leave it for some extra minutes, maximum 10 though.
Oke, jadi dok saya tadi bertanya sama dokter Fiorella, kan di videonya tadi saya lihat dia combine antara IUMA, dia injek langsung 1 ml di wajah, kemudian dia pakai exit pills, itu mau pakai TCA kah, atau mau pakai glycolic atau eh, yang lain, itu cuman didiamkan sekitar 5 menitan aja gitu, jadi nggak lama didiamkan. Jadi after injectable itu dokter boleh combine untuk dapat efek glowingnya gitu ya. Sekarang kan lagi tren tuh lalapil. Nah, itu dokter boleh combine sama lalapil atau peeling lainnya ya. Dokter, I want to ask a question more.
Mhm, please, yes.
For the fractional or ablative laser treatment after administer IUMA, bubble
Mhm.
injection on your slide, I look at. Um, it's a polynucleotide PN or some ingredients in the IUMA that's not degrade or damage after injectable and you ablative because in some product, competitor product, which is content of the HA or PN, is not allowed to combine protocol with the laser because the uh, energy-based device can reduce or damage of the ingredients. So how about IUMA?
So with IUMA, it's not the same issue because the only issue would be related to the hyaluronic acid, but it is not a cross-linked hyaluronic acid. It's free hyaluronic acid. So it will not be an issue even with the laser. It will still keep the idea of the hydration. It will not be targeted from the laser itself. If it was a filler, yes, I would agree with you.
Oke, thank you very much. Jadi tadi saya bertanya ke dokter, kalau misalnya kan beberapa produk skin booster itu kan kalau yang ada kandungan HA atau PN tuh nggak boleh dikombin treatmentnya dengan energy based device, baik itu fractional ataupun device apapun itu, karena dapat merusak si kandungan HA-nya. Nah, pada produk IUMA itu aman dok, jadi dokter boleh diinjek dulu, habis itu di laser itu tidak mengubah ataupun merusak si ingredients-nya. Nah, itu salah satu keunggulan dari si IUMA ini. Another questions again.
Mm,
I'm so
yeah,
really excited with your presentation, doctor, because
great.
uh,
Thank you so much.
there is polynucleotide contained in IUMA.
Sorry,
It
I
is
didn't.
yes, PN content in IUMA. It is safety for injectable around under eye because in some journal that I ever read that PN is not allowed to injectable on around under eye. So how about PN in IUMA? It's allowed or not? And then
The
if
polynucleotides, right?
yes,
Okay.
polynucleotide. And if IUMA is allowed to injectable in under eye, what the target layers? It's intracutan or dermal or subdermal, and how many percentage of the PN? Because I have a question from a doctor in here that how many content of the PN, how many milligram or percent? Thank you.
Regarding the milligrams, I have to check, but I have the whole ingredient that the certificate of the ingredient, so I will check even right now.
Yeah.
Related to the periorbital area, to be honest, the first polynucleotides that have been released on the market, they were from Italy. So in my country, they actually have been a huge historical background for safety of the product, even on the periorbital area. Especially the first paper that I attached to my presentation, it shows the consensus. So it's from the five most important scientific society of Italy. And they made overview and a study from all the years that they have been using polynucleotides, at least in Italy. So, and they confirmed the safety of the polynucleotides even in the periorbital area. So, to be honest, I will still consider it extremely safe. Related to the kind of injection in the periorbital area, it depends on the clinical situation, because if I only have a patient who has, for example, let's say dark circles or fine lines, I would perform the superficial injections, so the papules. If my patient have a bit of hollow, so it needs to improve a little bit the volume, I will perform deeper injections, so that over time, even it will improve also the structure. Let me check related to the polynucleotides itself. If I don't find it, I will definitely send it for you because we have the official ingredient. It only mentioned 1.7, so it should be 1%. It should be also 50 milligrams as well.
Okay, thank you
More or
dokter.
less, a little more than that because it's 1.7, so it should be over 50 milligrams.
Oke, jadi jawabannya kalau untuk kandungan PN itu sendiri itu 15 miligram ya kandungan PN-nya yang terkandung dalam produk IUMA. Kemudian kalau untuk kasus hollowness itu maksudnya kantung matanya kosong, itu kalau mau kita lakukan tindakan injeksi, itu dokter harus agak deep layers ya. Tadi sarannya dokter Fiorella, karena memang IUMA itu agak thick gitu, agak kental nih ya. Kalau diinjeksikan secara intrapetan, takutnya nanti papurnya lama. Makanya diinjeksinya deep layers ya. Oke, for the laxity case and Glasgow scale that you already explained before, for the Glasgow scale 3 and 4, how many sessions should be treated with IUMA with the best result, like in your presentation, right? And how much doses? It's only 1.5 ml. And what best combined protocol for application in our daily practice for laxity and ptosis? Because the main key of the IUMA is for aging. So I wonder about that. Thank you.
So for a more advanced glucose scale, so more advanced aging clinical situation, I would definitely suggest 4 sessions. And I would invite my patient, rather than wait 6 months to do the cycle, I would invite my patient to do a recall session, for example, 1 session every 2 months. Regarding the amount of product, if it's a very high situation of aging, I mean, very high glucose, you can even perform a little more product. So inject even 2 ml on the face. So you can increase the dosage in order to perform a little bit of a better outcome. Sometimes, of course, I did not mention this in the presentation, but you are always welcome to do sandwich technique, which means on the same patient, you can perform deeper injections and also superficial. So of course, you're going to need extra product, but you can work on multiple levels of the skin. So even the outcome is going to be better.
Oke, thank you very much. Jadi saya bertanya dok, jadi kan tadi dokter Fiorella mention untuk kasus laxity, kendur-kendur seperti itu, yang Lego scale 3 dan 4 kan kita lihat bagus banget tuh di slide-nya dia, hasilnya benar-benar kelihatan berkurang kerutannya. So saya bertanya, dia pakai dosis berapa banyak, kemudian protokol apa yang dia gunakan. Nah jawaban beliau, dosisnya dia pakai mungkin bisa lebih dari 1,5 yaitu 3 mili. Untuk kenapa dia pakai lebih banyak 2 kali lipat 3 mili untuk pasiennya dia karena dia pakai sandwich teknik. Jadi sandwich teknik itu dokternya injeksi dengan 2 different layers yang berbeda, yaitu pertama di dermal, kemudian di subdermal. Jadi ada yang agak superficial, ada yang deep. Jadi dia dua itu tujuan dia untuk mengurangi agingnya, penuaannya yaitu di deep dermal, tapi dia mau rejuvenation juga, makanya dia injeksinya agak intradermal seperti itu. There is a question from Dr. Henry Gunawan. Is IUMA allowed to cocktail with another product? Example like a collagen stimulator.
We don't have experience in that, so I cannot officially say yes. I know that some doctors mix it with fillers. So we do have experience on that, and that's totally safe. With collagen simulator, we don't have experience, to be honest. None of us have done it before. But I mean, I wouldn't say no because now we also have other products that have polylactic acid mixed with other ingredients, and I don't see interference potentially, but I don't. This is on a theoretical point of view. I don't have personal experience.
Oke. Dokter Henry, jadi jawaban Dokter Fiorella, dia belum pernah mengkoktel antara IUMA dengan Colstim, dan dia pun juga belum menemukan paper jurnal yang udah menjelaskan bahwa koktel antara produk yang ada kandungan RNA DNA kompleks PN dengan Colstim itu homogen gitu, bakalan homogen itu belum belum pernah. Mungkin saran yang bisa diberikan adalah mungkin boleh dikerjakan di waktu yang sama dok. Jadi dokter boleh injeksi Colstim dengan teknik yang berbeda ya. Kemudian dokter injeksikan juga di rumah, tapi nggak di koktel jadi satu. Mungkin itu ya dokter Henry ya. Semoga membantu ya dok ya. There is how many maximum doses for IUMA for one session? Did you have an advice for maximum dose?
Um, I wouldn't definitely not inject more than one vial. But we had experiences that one doctor just performed way too many papules in the area, but the only side effect that it showed it was just that the papules lasted longer, so a little bit of extra redness, but I would say no more than one vial. Once you do the small papules, you basically make one every centimeter or even less. It is still very safe. There's no big issues.
Okay, thank you very much, Doctor, for your presentation and answer. Really, really,
Thank
really
you.
good.
Thank
I
you so
hope
much.
I hope next time we can collaborate it again with you.
For sure, it will be my pleasure. Thank you so much to you, your company, and all the attendees. It was my pleasure to spend some time with you.
Thank you so much. There is a lot of knowledge, and this is also will help to enhance our clinical practice in here, and also elevate the standard of patient care in Indonesia, how to using IUMA. So thank you very much. Before we are closing, um, saya mau ngomong bahasa Indonesia. Dokter jangan lupa ya, nanti follow IG-nya Anaya, yaitu Anaya Adi Kencana ID. Nanti dokter di sana bisa lihat tuh ada apa aja Anayanya. Kemudian nanti ada free satu file IUMA untuk pertanyaan yang terbaik. Nanti saya yang pilih ya. Kemudian kita juga nanti tanggal 30 Juli, dokter jangan lupa kita punya webinar medico legal, nanti ngebahas tentang hukum kedokteran dalam praktek estetik, kemudian biostimulation call stim dengan menggunakan produk MyShape Elixir. Nanti untuk spesial untuk peserta yang hari ini ikut webinar, itu dapat diskon 50%. Jadi langsung hubungin salesnya ya dok, untuk daftar ya. Ya, kemudian kita juga ada promo IUMA buy one get one free for today. Jadi jangan lupa langsung dokter order sama sales kita ya. Let's take a picture together with our pretty speaker for this noon, Dr. Fiorella, our in-charge speaker. Give it applause once more time. Thank you. Thanks for your time and your dedication to continuous learning. Have a wonderful day for everyone. Before we closing, we'll take the picture together. Please open your camera, doctor.
Oh gosh, how do I do that? This is
Let's open your camera.
oh my gosh, how do I do this? I swear I don't know. Oh, the video simply.
No, that's okay. Yes. Udah? Oke, dokter, yuk open kamera yuk, dok. Dok, berikan senyuman paling cantiknya sore hari ini. Karena udah dapat ilmu yang sangat banyak banget nih. Saya berasa lagi kuliah lagi biomed hari ini. Oke, udah pada buka kamera nih. Oke, kita hitung ya. One, two, three. Another pose. One, two, three. Anaya dong, please. Anaya, Anaya symbol A.
Like that?
Yes, right hand. Okay. Udah, Vincent? Okay, one, two, three. Okay, thank you very much, doctor. I'll see you in another
Yeah.
session.
Thank you so much. Bye bye. Thank you.
Bye-bye. Oke, dokter jangan lupa ya, yang daftar hari ini ada promo buy one get one. Jadi nanti langsung chat aja salesnya ya, di teror aja, bilang gitu. Nanti kalau misalnya mau ikut hands on, kita ada hands on juga nanti free hands on. Nanti ditunggu aja di story Instagramnya Anaya kapan kita adain free hands on untuk produk IUMA ya. Terima kasih banyak. Saya akhiri sesi webinar hari ini. Terima kasih banget untuk antusiasnya. Saya akhiri. Assalamualaikum warahmatullahi wabarakatuh. Selamat sore semuanya. Bye bye.